Dr. Ganz, I want to talk a little about stomach ulcers today, peptic ulcer disease, I should say, stomach and duodenal ulcer, and a bacteria called Helicobacter pylori. And I'll just tell you my personal story and interaction with it. So, a long time ago, long time ago, this is decades ago, people thought that ulcers were caused by stress. You got stress, that increased acid secretion, and that increased acid secretion from stress caused ulcer disease. Turns out to be completely false. Stress has nothing to do with peptic ulcer disease. You can be stressed all day long. It's not going to increase your acid secretion. It's not going to cause an ulcer. It's just a totally false premise. But that was the premise for a long time. And when I was at Northwestern, there was a very famous doctor decades before me named Dr. Sippy, S-I-P-P-Y, and he had the Sippy diet, which is this high milk and cream diet that ulcer disease patients would take. So just a lot of old nonsense for peptic ulcer disease. So it turns out ulcers, stomach and duodenal ulcers, are caused either by a bacteria, Helicobacter pylori, that you can pick up and carry throughout your life, or certain medications like aspirin, or certain arthritis medications like Motrin or Indocin that can weaken the lining of the stomach and cause ulcer disease. So let's talk about H. pylori today. For this video, we'll just talk about H. pylori. So H. pylori is a bacteria that typically you pick up in infancy. It comes from very crowded households. A lot of people sharing a bathroom. A thing called the crowding index is a hallmark of H. pylori. The more crowded your household, the more likely you are to have H. pylori. And H. pylori is transmitted from person to person. You typically get it in your infancy, and you carry it with you throughout life. Once you get it, it's very hard to get rid of it. Now, usually causes no symptoms in people. Most people carry H. pylori silently. They don't know that they have it, but about 10 to 15% of people can either get a stomach ulcer from it, or stomach cancer, or you can get a duodenal ulcer. So there's three different reactions that happen when you get H. pylori on a chronic basis. You can have a certain serotype of H. pylori and a certain reaction to it that weakens the lining of the stomach and causes inflammation. So it weakens the lining of the stomach. You can get a gastric ulcer, and chronic inflammation there can lead to gastric cancer. That condition is called multifocal atrophic gastritis that can lead to gastric cancer or gastric ulcer. Or you can have a type of H. pylori and a reaction to that type of H. pylori that increases acid secretion, and then you get duodenal ulcer. So two different things can happen. You get stomach ulcer, stomach cancer, or duodenal ulcer. I guess those are three things. And then the last thing that can happen is you can get a thing called autoimmune gastritis, where you stop making acid completely, and that is also due to H. pylori. So that's H. pylori, and that's what can happen to you when you get it. It's a very interesting bacteria. Now, along comes me, and I'm a trainee, and I'm just new in training, and I learned about H. pylori, and I wasn't quite sure what to make about it. And I got out in practice, and H. pylori started to become a thing where people started actually understanding that ulcers weren't caused from stress, it's caused from this bacteria. And there was a test for H. pylori called the CLO test, C-L-O test. It stood for Campylobacter-like organisms. This is so early in the game that H. pylori didn't even have a name yet. We called it Campylobacter-like, later got renamed H. pylori. But this test required an incubator because the test had to be heated. You'd go in the stomach, take a biopsy, and you'd take this biopsy sample, put in this little well. And if H. pylori was present, it would convert urea in this little well to ammonium, and that would cause a color change reaction in the well. Now, the well had to be incubated, and I created an incubator. We invented an incubator for this device, and that was my first successful invention, the CLO temp incubator. And I thought I was really hot stuff, and I kept going for other inventions in H. pylori, started lecturing on it widely, and we wanted to film a little documentary on H. pylori. So we filmed it, and we wanted to film it moving through gastric mucus. But every time we filmed it, tried to film it, the organism would die. We would just get a bunch of dead organisms. And one day, it just occurred to me that light was killing H. pylori. And nobody knew this. This was like a brand new thing. So we investigated it, and it turned out that blue-violet light, 405 nanometer light, kills H. pylori. H. pylori is a photodynamic organism. In other words, it has PP9 and protoporphyrin. You shine this light on it, and it kills the bacteria. So we did a bunch of studies, using an arc lamp, because in those years, blue light LEDs weren't invented yet. There were red light LEDs and yellow light LEDs, but no blue light LEDs. So we had to create an arc lamp and filter out the blue light and get that in the stomach. It was cumbersome and complicated, but it worked. And I was all excited, and we published our results and sent it into a bunch of journals. And people thought it was so crazy that nobody would publish. I probably sent it to 12 journals, got rejected every time. I finally got it published in a journal called Lasers in Surgery and Medicine, fairly high impact journal, and the study's been cited a lot. It's a very interesting study. So that was my first foray into killing H. pylori. Unfortunately, it never worked as a treatment because this arc lamp was really cumbersome, created a lot of heat, and it was too hot in the stomach, caused a lot of stomach scarring. And blue light LEDs came out some years later. You might remember a thing called the Sony Blu-ray, which was using a blue light LED to play CDs. So unfortunately, had we had blue light LEDs in those years, I might have had a successful invention, killing H. pylori by shining blue light in the stomach, but we didn't. So that's my story on H. pylori. It's a super interesting organism. I know a lot about it. We did a bunch of studies on it. I published quite a bit on it. And that's kind of the backstory, my backstory of H. pylori. So now you know.